such an honor indeed for me to be here with Dr. Richard Besser and share a candid conversation with the more than 1,000 rural visionaries who have joined the Assembly, which I guess tells us we're quite a thirsty bunch for sharing and caring across the land. Thank you everyone for being here. And so Rich, I really can't think of anyone more qualified to comment and reflect on the disparities that have so long affected our rural communities and which are now more exposed than ever due to the pandemic. And I know that you share this Assembly's, have always shared this Assembly's commitment to working together to build a more just and inclusive nation where prosperity is driven not just by equality, but also equity. What can we learn from this moment in our history about building a nation that really values all of the people in all of the places throughout their entire lifespan?
p.m. Eastern Time, feeling really good. Don't be afraid of COVID. The president writes, don't let it dominate your life. We have developed under the Trump administration some really great drugs and knowledge. I feel better than I did 20 years ago. This comes as we expect a medical briefing from the president's doctors anytime now. About 10 to 15 minutes from now is what they've told us for our guidance. Let me go to Peter Alexander, who is on site at Walter Reed Medical Center. Peter, we had heard that perhaps the president would be discharged today. Now it appears from his tweet that he will be.
Yeah, that's exactly right. And what's notable is that this announcement came from, I guess, what you would call the patient in chief and not from his doctors. The announcement coming from the president by Twitter even before his doctors had an opportunity to brief reporters on the state of his condition. And of course, there's been a lot of contradictions and confusion about his health over the course of the last 24 to 48 hours. So when he departs this evening at 6:30, his total stay at Walter Reed will have been less than a total of 3 days. But in conversations I've had with those close to the president, they say that he has communicated that he is, quote, ready to get out of there. The president has been itching to depart for at least the last couple of days. He says he's been feeling well, but one of the questions has fundamentally been exactly how well he is, given the fact that among those drugs that he's taking right now, a steroid called dexamethasone. That is a steroid that's typically given to severely ill coronavirus patients. Behind us right here, you can see a crowd has gathered, more than 50 Trump supporters, many of them yelling and screaming as cars pass by, honking in support, trying to demonstrate their support for the president. The president yesterday had been pushing to go home, but settled for that little impromptu drive-by that we saw. Today it appears that he will be departing for good from Walter Reed. The question now remains, if there's a setback, will he be forced to return? I'm told it's been communicated to the president that the bad optics of a setback would be particularly bad for him now less than a month from the election. Kate?
Federal health officials today issued their latest guidelines on the flu as cases of the swine or H1N1 flu continue to spread. Joining us now, in fact, joining ABC News today as our senior medical editor is Dr. Richard Besser, a veteran of the Centers for Disease Control and Prevention who has spent years on the front lines of the most important public health issues. And swine flu is certainly a public health issue on everybody's mind. As they say, everybody's talking about it.
That's right.
So let me ask you some of the questions that I hear. If this flu is relatively benign, why do I need to worry about it?
You know, I think that's a great question, and it's one that I get all the time. There's several things people need to understand. One is, whenever there's a new outbreak, there's uncertainty. How this will unfold is not clear. What we've seen so far has been very encouraging in terms of severity. Another reason people need to worry or need to take action is what we do now as individuals and as parts of communities will impact on how severe this is in our own communities and around our country.
You keep talking to me about individual responsibility. What do you mean?
Well, there are several things. We talk so frequently about the importance of hand washing. Hand washing will help prevent you from getting sick, but it will also help prevent you from transmitting the infection to others. When you're sick or when your children are sick, keeping them home. It's hard to work effectively when you're sick. It's hard for children to focus when they're sick, but also when they're sick, they're more likely to transmit that infection to other people.
We are all anxious about every sneeze, every cough, every door handle as we confront an outbreak of flu coast to coast in this country. And it's not just the flu, another virus is on the move. I want to show you pictures that say everything. Patients wearing masks. And also doctors wearing masks. ABC's Lindsay Davis spent the day at the hospital with the doctors on the front lines.
And the elderly. But this flu can also have deadly consequences for healthy adults. Strong immune systems can sometimes overreact and destroy healthy tissues along with the flu itself. And this year, there's a double threat. Not only is flu rampant, so is a nasty stomach bug called the norovirus, now widespread throughout the country. It's also very contagious and another serious concern for hospitals. A perfect storm of sickness, which is why today 45,000 Bostonians got an automated call from the city.
Residents who have not already been vaccinated against influenza this year are urged to get vaccinated by
Dr. Walls, for one, is hoping people listen. He knows better than anyone flu season hasn't hit its peak yet. So far, this hospital has treated 280 confirmed flu cases. In all of last year, they just had 63. But this is another hospital where doctors say they're beyond the point of testing every patient. Their focus right now is simply treating them. Diane?
Overwhelmed. Okay, thank you, Lindsay Davis. I want to bring in ABC's chief medical editor, a veteran virus hunter himself, Dr. Richard Besser. So, Rich, should everybody be going to the ER when they feel sick?
Yeah, I mean, absolutely not. If you were healthy before you got the flu and you're handling it well, you don't need to rush to the ER or your doctor's office. They're going to keep you waiting a long time, and while you're waiting there, you could get sick with another virus. So give them a call, and they could handle it that way.
And who should go? What kind of symptoms?
Yeah, you need to watch for the signs. If you have any difficulty breathing, any shortness of breath, you may have chest pain, that could mean pneumonia. Sudden dizziness or confusion could mean that you're getting dehydrated. And if you're getting better and then you start to get worse, that could mean you have a bacterial infection on top and you need to be seen right away.
You didn't mention fever.
No, it depends what goes with the fever. Fever by itself, don't worry about. But if it has any of those other things, get seen right away.
All right. Thank you, Richard Besser.